The other medication which is on the market is minoxidil, which we had touched on before, and that's available in a spray as 2 and 5%. It's also available in the United States. Since we're in Canada, we can get 2% over the counter, but we can't get 5% over the counter. In the United States, you can get 5% spray over the counter, but also in the last year and a half, a 5% foam became available over the counter in the States. The foam is better than the spray because the spray, the base is isopropyl alcohol, and that's the vehicle that allows you to get the medication onto your scalp. The foam is better, and the base is glycerin. And the reason it's better is because it doesn't cause the irritation or dryness that the alcohol spray can give you. Plus, because of the foam, it's better absorbed. And it's so well absorbed that the therapeutic half-life, meaning the amount that it's working on your scalp, is about 22.5 hours with each dose. So that's very good. Some other studies have come out to show that both finasteride and minoxidil may be synergistic, meaning they both work better together than alone. So if you're really motivated and you're trying to maintain your hair as best as possible, you could use both finasteride and minoxidil. And they both work differently. Minoxidil increases cell turnover and cell culture and improves the microcirculation. It doesn't have anything to do with the hormones, so you're not overdosing anything, and again, it could be synergistic. So that's something you might want to think about as well if you're trying to maintain your hair, especially on your crown, for a longer period of time.
Okay. Have they gotten any advances now in hair follicle cloning?
Well, that's a very good question as well. There's lots of research going on in hair follicle cloning, or stem cell multiplication it's called. And that's where you can isolate a human stem cell, a cell that will become a hair follicle. And there's a lot of trials going on across the world, in Europe and in North America. However, we're not there yet. Reproducibility of these multiplied stem cells and longevity of these stem cells isn't here yet. I think it will come to the market, but whether it's in 3 years or 13 years, time will tell. Well, Mark, what I'd like to do at this point, with your permission, is draw a hairline on your scalp. And the reason I do that, it's a good idea for you to get a good idea of what I'm expecting, and I can just see what you're expecting, so we're both on the same wavelength. But don't worry, this hairline does come off, okay? And in my opinion, one of the biggest reasons for a bad result in hair restoration surgery isn't medical, but it's cosmetic. And the number one reason, in my opinion, is a hairline that's too low. Often fellows that are younger fellows, they remember having a hairline that was quite low, and if you try to duplicate that, then you can get into trouble in the future. So you want to have a hairline that looks natural for the majority of your adult life. And you have input into this hairline, by the way. There are things I would do and things I wouldn't do. And so I like to see what you think of this hairline and go from there. In drawing the hairline, it's also very important to anticipate where you may thin down to in the future. Because what we don't want to do is not anticipate future thinning and have you develop a thinning triangle of thinning hair. So that as best as possible, you'd like to anticipate. And that's, again, where age is an important factor. Because if you're only 21 years of age and I'm drawing on this hairline, I wouldn't really have a good idea as to how low you might go in the future.
When you say thinning triangle, do you mean like up in here, this area?
Yes,
or?
Because you'll see that I'm drawing a hairline going perpendicular, or parallel I should say, with the ground. And you're certainly thicker in this region here than you are through here. However, thinning is ultimately, as I was mentioning before, horizontal with the ground. And if we just stopped the transplanting to here and didn't get into this region here, then you might start to develop a thinning triangle in through here in the future. Doesn't mean we need to transplant down here, but you want to anticipate future thinning. Alright, so Mark, I've drawn the hairline on, looking at different locations. We need to, the most farthest forward point of the hairline shouldn't be any lower basically than an imaginary line. If you take 4 finger widths up from your eyebrows, that brings you to about here. If we start to go too low, then it starts to look fake. You may want to have the hairline you had when you were 15 or 16, but that doesn't look natural as you get into your 30s, 40s, and so on. I was explaining before about the triangles through here blending into where you may have thinning in the future. So if we look through this whole area, we want to get transplanting in through just behind the hairline, but into this region in through here as well. And we'd be stopping somewhere about here. At this point, Mark, I'd like to ask you what you think of the hairline, so I'd like to give you a mirror so you can take a look.
Okay.
So in explaining the hairline, you can see that this is an abrupt black line. In fact, we don't put the grafts in the straight line, but again, I have to draw in something for a location to show you where we'd be starting. So certainly, it's not bang, 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 but it's a gradation. We go from one-haired grafts to irregular 2 to 3 haired grafts as we go further back from the front hairline.
Mm-hmm.
Okay. Do you have any questions about the hairline at this point?
No, it looks pretty good actually. Probably goes down lower than it used to be. No, actually, there is some hair there, so that's where it started.
Yeah, you can see that just down here, you have hairs down here, and we would not go that low.
Right.
We'd be starting just above this black line, again in an irregular pattern. When we develop the new hairline, you have irregular one-haired grafts, and then they're called cluster grafts. Hairlines have mounds. We may give you like a pseudo little widow's peak, and some mounds on either side, and then have it gradated into the corners. The other thing about transplant at this point in time is you have enough hair to easily camouflage what we're doing.
Mm-hmm.
You see, as you comb your hair forwards, we really don't see where that black line is, so the hair you've got will camouflage well what we're doing, and that's why this is a good time to look into transplants. Again, this is an abrupt black line drawn on with a grease pencil. In fact, we do not put the grafts in a straight line. It's very irregular. We go from the odd eccentric one-haired graft to little clusters of one-haired grafts, and then denser as we go further back.
Okay, so it's not so it doesn't look like doll hair, because I was worried about.
Exactly. We don't use the old style circular plugs anymore. Gone are the days of the 3.5 millimeter diameter plugs. Certainly that was the common technique prior to about 15, 18 years ago. But the downside of those were they looked like rows of corn because they were so dense, and you had to leave an equidistant space between each graft. And now we do something called follicular unit transplantation. Instead of 3.5 millimeter diameter plugs that might have anywhere from 10 to 30 hairs per plug, we're now doing individual follicular units. Now, a follicular unit is a naturally occurring bundle of hair that has anywhere from 1 to 4 hairs, on average about 1.8 to 2 hairs per follicular unit. And so that mimics nature much better. So that's why results are so much more undetectable these days. So when we do a natural hairline, mimicking a natural hairline, we go from a little one-haired follicular unit to 1 and 2 and 2 and 3 as we go a little bit further back. But nothing so big that it's going to look clumpy or pluggy.
Okay.
Do you have any other questions about the hairline?
No, it's looking great.
Well, I would suggest at this point in time 1 session. But a question that patients should know and would like to ask is how many sessions may I need in the future? Because I think it's important with hair restoration surgery, especially in younger fellows, to know what they need now, but also what they might need in the future.
Okay, so I can do multiple donations from the same site? Or?
Yes, you have enough hair in your permanent donor fringe that I know you could do at least 3 to 4 different sessions. Okay. Now again, how big is a session and so forth, and we'll touch on that. But it's also important to know that in terms of the worst case scenario, meaning the worst case scenario would be, what if you lost the rest of the hair up here? To do that area well, so if you were sitting in front of me and you were bald and did not have any hair there, I would say it could take anywhere up from 1 to most likely 2 to 3 sessions to get the density you can get with hair transplant. Certainly with today's techniques, 1 session can look very natural in an otherwise bald area, but the bottom line is 2 sessions is thicker than 1. We're still limited to how close we can put the grafts together in any 1 session. Certainly if you have early thinning, have 1 session and then wait until when and if you have more thinning. But also incorporate it into how many sessions do you need and how quickly are your expectations. You know, you might have an identical twin or clone sitting right here. You're really happy with 1 session. The clone has exactly the same thing. He's very happy as well, but he's decided, you know what, I wouldn't mind it being a little bit thicker. So expectations play a factor.